And here now to talk about those benefits of breastfeeding is Mary DeNicola, family nurse practitioner and certified lactation consultant. Thank you so much, Mary, for joining us today. We appreciate it. And if you recognize Mary from the story, I don't know if you do, but there she is right there. Let's talk about, this is a huge breakthrough, this study, with explaining how the immunity transfers from mother to child. But there are so many other benefits for breast milk. Let's talk about that.
The benefits really are that breast milk helps to decrease the incidence of almost every single childhood disease. So asthma, allergies, eczema, diabetes, ear infections, urinary tract infections, gastrointestinal things, every single thing that can happen to a baby happens less when they have the protection of mother's milk. There's medicine in mother's milk that we can't get anyplace else. I can't even write a prescription for some of the things that mothers pass on to their babies without even thinking about it.
Okay, let's talk about some of the benefits for the mother for breastfeeding.
Well, one of them is that you burn calories as you breastfeed. So,
Yay!
you know, you can lose some of that pregnancy weight. Another health benefit is that there is less premenopausal ductal breast cancer in moms that breastfeed. It's probably due to the lactoferrin component of breast milk.
Okay, let's talk about formula. I know a lot of kids have been fed formula. I was one of them. Mother. Is it a bad idea? Is it a good idea? Is formula okay? What do we know about formula?
Well, breast milk is the gold standard, and formula tries to imitate breast milk. That's why it's called formula. They tried to come up with a formula to imitate what mother's milk has. The problem is they're never even going to get close because the proteins are different. The formulas, most of them, are based on cow's milk, and so what you're giving babies is a protein that their body isn't meant to digest. It's called beta-lactoglobulin, and it's very hard to digest. That's why formula-fed babies have more colic, more constipation, more fussiness. Now, they will grow. If you want to compare it to another health and safety issue, it's sort of like, would you use a seat belt for your baby rather than an infant car seat that was custom made for a baby?
Right.
Of course not. So why would you use formula instead of breast milk? The seat belt is going to hold on to a baby unless you slam on the brakes. Formula is going to allow a baby to grow, sometimes too obese, but formula is going to allow a baby to grow. But if there's an infection, there's nothing in formula to help fight off infections.
Okay, let's talk about something I personally noticed. You go into almost any department store right now. These places are outfitted for breastfeeding moms, for pregnant mothers, and I think it's fantastic. Is our society becoming a little more acceptable? Were they not or more accepting of breastfeeding, perhaps in public, making these accommodations for these ladies so they can public or privately do what they need to do? I just find that interesting.
I think so. I think you can go to malls and find stores that have nice women's lounges where you can sit and breastfeed, and there's been a national campaign to promote breastfeeding, and so I think that word has gotten out. It's not like in the 50s when formula was the thing to do. I think La Leche League has brought this back over the last 30, 40 years, and more people are breastfeeding than not.
You are a huge advocate for breastfeeding for so many other reasons. Tell us something we don't know about breastfeeding and why mom might want to choose this option.
Well, breastfeeding gives a baby protection with every single feeding. I don't think moms realize that we can't replace those special proteins that are in her milk. They're called immunoglobulins. And when a baby's born, their immune system is not mature, and it takes probably 6 months before a baby can fight off infection. Our immune system is how we live in harmony with germs. There's germs all around the place. You and I get a cold, our immune system eventually fights it off and we get better. We don't have that cold forever. When a baby's exposed to germs, they can't fight that off until their immune system is mature, and so they rely on mother's milk to get them through that first 6 months.
And Mary, it's free, right?
And it's free. It is the right price. It is on tap, readily available, always the right temperature.
Always the right temperature. Yeah. Thank you so much, Mary DeNicola.
You're welcome.
Thank you so much.
When you think health, think IRU.